Good afternoon, everybody, and welcome to the IOSH Aerospace and Aviation Group's webinar on preventing MSDs, a winning strategy. I would love to introduce one of my colleagues, Lina, who is an occupational health physiotherapist who works for British Airways as an ergonomic specialist. And she's going to share the journey that she's been recently implementing for below-wing colleagues at Heathrow Operations. Lina, if you'd like to take it away, thank you.
Thank you, Jo. Hi, everyone. Nice to meet you all. So as Jo said, I'm going to share our journey in delivering, I guess we can call it a winning strategy. So implementing more focused rehabilitation for our below-wing colleagues in their workplace. As Jo said, I work at BA as the MSK and Ergonomic Specialist. My background is in occupational health physiotherapy. And I work within BARS, which is our British Airways Health Services. So it's an in-house occupational health service that we have. But what I'm going to be talking about is our BARS Health Hub, which we've opened airside so that we can bring health and wellbeing support directly to our colleagues in their workplace. But before I go on to talk about that, I just want to talk about our in-house service. So we provide tailored care. By being in-house, we understand the work demands our colleagues have within their various roles and understand the culture within their work in. It allows us to build positive colleague and manager relationships and to have proactive conversations. So we have our OHAs, which are occupational health advisors, who are aligned to different business areas. And they have regular meetings with managers so they can discuss cases for any that need support within the workplace. We also have skill bias sessions for those managers so they can understand the role of our health services and also how work can be good or good work can be good for health and how we can support that. We're very much embedded and nuanced to the clinical requirement for that individual. So, for example, with the physiotherapy, we do provide an in-house provision, but we also have an external supplier as well, because taking into account, we have colleagues based quite widely across UK. And so we can provide in-house assessments, but we can also provide one-off consultations so an individual can understand their musculoskeletal condition and what support is required, or enable them to have conversations with their GP so they can access the required support within the NHS. So we could carry out Teams calls with people that might be based up north. So it's very much dependent on what the colleague requires. In terms of the physio in-house, that's very much a specialist occupational health provision, and it's very much person-centered and work-focused. We take time to understand our colleagues. So we take time with our assessment where we understand their problem. We carry out an objective assessment. We go through their diagnosis. We give them advice on their condition, what they can expect in terms of recovery, and how work can play a part of that, and how that is part of their rehab. The area of the business that refers mostly to BARS is Heathrow Ops, and so that's one of the reasons we've set up this health hub for our Heathrow Ops colleagues. So over 56%, so over half of our referrals are from Heathrow Ops. But before I talk about the health hub itself, if we just talk a little bit more about musculoskeletal health and the impact at work. So MSK health can affect people of all ages, but as you can see from the graph here, it starts to increase as we get older. And we've got an aging workforce with people staying in work for longer. And with people getting older, they are reporting more than one condition. So most people over the ages of 40 will have comorbidities. And people who report having more than one or two conditions tend to report having MSK conditions. And so we've got a workforce that have an MSK condition, but they also have other health conditions as well. And we know that movement is really good for your musculoskeletal health, but we also know that being at work is being good for your health. But when surveyed, so these are infographics from Versus Arthritis. When they surveyed people, over half of people surveyed said that their symptoms had a negative impact on work. And in terms of FitNotes, MSK conditions remains the second most common diagnosis on FitNotes written by GPs. and this was dated back to September 22 to September 23. There's been a recent research project looking into fit notes, and what they found is that GPs tend to sign people off sick, but physiotherapists and occupational therapists tend to sign people back into work, but on a phased return to work plan. And so that is a piece of work that's going on in the background. Because as I mentioned earlier, being in work at an early point is really good for your health and good for recovery. The other thing to point out is that over half of those fit notes issued for MSK conditions tend to last more than 5 weeks. And that's quite crucial because if someone's off sick for 6 weeks beyond and they still don't have a return to work plan or an idea in terms of when they're going to recover, that increases the risk of someone developing chronic conditions, and that can have a huge impact on their recovery and ongoing long-term conditions. I think the other thing to point out here, there's a recent review done by the UK government, well, it's an independent review called Keep Britain Working. It was led by Sir Charlie Mayfield, and he wanted to gather insights on workplace health. And there are 4 areas that the review had identified for people tending to fall into inactivity or economic inactivity. This has been a lot of spotlight on this in the media recently. And one of those 4 areas was for middle-aged employees. So those people aged between 35 and 49 with MSK conditions falling into economical inactivity. So it goes to show that we really need to be working to keep them in the workplace, but support them with good work. So going back to our Heathrow ops, why this is important for Heathrow ops, the job itself is very much demanding. It's a very industrial job for our colleagues that work below wing. It involves lifting, pushing, pulling, driving and operating heavy machinery. And if we think about what we have in place currently, we can give them manual handling training, which helps to prevent and protect them at work. But we can also do a little bit more in terms of giving them occupational rehab. And that's one of the things that we set up within the BARS Health Hub. And the idea of this is to keep people happy, healthy and engaged in the workplace itself. The graph on the right shows the rate of self-reported work-related MSK disorders. And this is from HSC. And what you can see that back from 2001, 2002, it was on a downward trajectory. Then it became a bit steady, but in the last year, there's been a bit of an uptick. HSC themselves don't know why that is, and they are exploring this further. So we know that MSK disorders are on the increase. We know that people are going to be working for longer, so we have an aging workforce. We also know that people have more than one health condition, and of that, one of them is going to be an MSK condition. And so taking that into account and also looking at the cases that we were getting in terms of referrals to physiotherapy, we set this health hub up here. So as mentioned, our occupational health physiotherapy is all about the colleague. So we want them to understand their diagnosis. And part of that is talking to them about their recovery and going through the expectations in terms of their recovery and timescales. And we find that really helps them build up their workability and confidence. The occupational rehab session itself is run by an occupational health physiotherapist who are experts in movement and function needed for work tasks. It also gives us an opportunity to have those kind of conversations where we promote good health, physical activity, and the importance of keeping fit and injury prevention. It helps to empower our colleagues to be physically resilient for work, but also for life going, because work is part of life. And then when people do leave work, we want them to be fit and healthy in their retirement as well. So we've set up this rehab class, which is very much tailored to specific demands of our colleagues. So what we did is we spent some time looking out the window in this from this health hub, and you can see the pictures on the right. The top 2 are views walking to our health hub, so they're great views. So we're very lucky to see that on our way to work. And the bottom 2 is the rehab, well, the health hub that we've opened up and the gym space that we've got. And so Darren's a physio that works over at SAA. We spent time looking out to our colleagues to see what was happening when they were loading the bins into the aircraft, as they were driving, pushing the bins from the dollies onto the elevator or the elevator, and what they were doing throughout their shift. And that gave us a really good insight in terms of what we wanted to put into the rehab to get people fit to do their jobs in the task that's required. So it's circuit-based rehabilitation. We have 6 in a group so that we can also provide guidance throughout. What this shows here on the left-hand side is how specific we are in terms of the rehab that people will undertake. So anyone that's referred to BARS physiotherapy, and if we feel that rehabilitation will be useful or beneficial for them in terms of their recovery, we will then go through with them, after we've identified their rehab goal, each of the stations and what the aim is for each of the stations and what exercises they will do. And over a 6 to 8 week period, they will progress through this program, hopefully getting stronger and fitter for their job. The pictures on the right are some pictures from our BARS team and our Heathrow Ops. So as part of the launch for our rehab classes, we invited our BARS staff and our Heathrow Ops managers to come over and try out the exercises. And we can see they really enjoyed it here, and it was gave them a really good insight to what will be expected from our colleagues and how we're going to really push them so that they can become physically fit. It was quite a bit of a journey to get to this stage in terms of getting a space airside, which was a big win for us, and to also be given a really lovely space, which had adequate room. We've got showering facilities, and as you saw, we've got really great views from it. But it took a lot of conversations. So within BARS, when we set up the in-house physio service, it was really well received and it's been really, really successful. But having conversations with our chief medical officer and our occupational health physician, we identified that there were a group of people, so Heathrow Ops being the biggest referrers to physiotherapy, that some of them require further rehabilitation, and that having something like that in the workplace, more embedded airside, would be really beneficial. So they started having conversations with various stakeholders at various meetings. Our director of Heathrow, Tom Moran, got video from him later on. He was really, really supportive, and what he asked was for us to come over to our Heathrow leadership team meeting over a year ago to present what our vision was in terms of MSK. And our vision at BARS is to take much more of a strategic and impactful approach, driven by what our colleagues say and want and need, but also by the evidence and the data that we have. And so as part of that update to the HLT, we talked about rehabilitation and how important it is for our colleagues and how important it is for us to have something like that embedded in the workplace. So he was very supportive. Our colleagues gave really good feedback in terms of what they felt they needed to feel confident and happy and safe when they do come to work, especially after an injury or illness. So having an injury and illness and coming back into work to do a physically demanding job, it can cause some anxiety for people. And so to make sure that that journey is positive for them, to allow them a period of work hardening essentially would allow them to restore their physical fitness and to be able to resume their normal duties with confidence. We spoke to Heathrow operation managers to see what they were seeing when they were managing absence cases or people in work who were struggling. And we also liaised with property in terms of finding a location, but also carrying out all the relevant risk assessments. So what I've got now here is a video. So I'm going to play it. So hopefully it will play for you. But the video will have Tom Moran, who's the director of Heathrow, giving his view, and then Colin Story, who's a ground op agent who's used the facilities. But he used the facilities before the rehab classes had started. And then Darren McKay, who's a physiotherapist that runs the physio clinic and the rehab classes. This video was done for a previous conference. So in the video, Darren mentions hopefully the rehab classes will have started. They have started now, so I just wanted to point that out.
Thank you.
Heathrow for BA, and I just wanted to take a few minutes to tell you how excited I am, the whole team are, about this fantastic new facility we've got here, thanks to the support of BARS, which is our BARS Health Hub. Behind me hopefully, you can see what we call the ramp. So we are airside here at Terminal 5, and around us are literally thousands of my colleagues who are every day doing really quite tough jobs. It's in my interest, and of course their interests, to give them the support they need to keep them healthy at work and when they're not at work. So part of that is bringing as close to them, as close to the workplace as possible, the support that they need to keep themselves healthy, and of course to get them back on track if something happens to them. And that's exactly what we've got here. So you can see the gym facilities we've got here, which are all about well-being and hopefully keeping yourself nice and healthy. But I suppose even more excitingly, and I'm very, very grateful to BARS for this, we have both a treatment clinic and the option for rehabilitation classes here just to my left, as well as trained professionals to do all of that. So it all adds up to something that I think is a fantastic investment in our colleagues. It's something that's already proved very popular, and I'm confident it'll also actually pay back in terms of keeping as many of our colleagues as possible in work, healthy, happy and engaged. I hope that's useful, and I'll just off to do a light workout. Okay, thank you for listening.
Hi, my name is Colin Story. I work as ground operations, looking after the tugs in SAA. I injured my Achilles and there was a long waiting list at NHS. So I contacted somebody within BA, which managed to get me into BARS treatment, which is also situated in SAA, and started my treatment. My treatment with Darren was absolutely outstanding. The first treatments he gave me, I went away, I'd done the treatments and noticed a big improvement. Unfortunately, I'm still in the treatments stage, but as for Darren, I appreciate everything he's done for us. I think BARS situated in T5 is an excellent idea. It's good for rehab. It's also good for anybody that may have a niggling shoulder that could pop over and speak to somebody about it, and hopefully Darren can solve that issue.
Hello, I'm Darren. I'm one of the occupational health physiotherapists that work for British Airways, supporting our operational colleagues in and around the business. I'm lucky enough to be in the SAA building, which is one of our operational buildings, sort of tucked behind Terminal 5, right next to the runway. So I have access to lots of planes and bags and trolleys and all sorts running around, with literally thousands of staff back here that we are supporting to help keep fit and active behind the scenes. The roles that our people do are often quite heavy, so lots of heavy lifting and pushing and pulling of bags, trolleys and equipment, and they have a very specific set of requirements to be able to carry out those tasks and to be able to sustain those tasks over a long period of time. The idea of putting the gym here was to support that very specific need and to make it really occupational specific and individual, of course. So we have our treatments facility. I offer rehab and on-site treatment, and then we offer our rehab classes, and we have a space here where we can obviously run those classes, which will be a circuit class running around here with all of the exercises designed to challenge people in the jobs that they do. Anything from overhead stuff to pushing, pulling, ropes, all sorts of stuff that requires fairly high demand. Those exercises will be selected for the individual person attending the class, and the class will run as a circuit. They're hopefully going to start within the next few weeks, so we're really excited about that. In the meantime, we've been using this great facility to get people fit and active and mobile with all the weights, etc. that we have. It's been a really exciting journey putting this together with Lina, and our focus is absolutely on how to make rehab, physiotherapy, strengthening, conditioning and well-being at the absolute core of what we do, right in the centre of the business, making it as work-specific as we possibly can. Enjoy the rest of your conference, and thank you for listening.
So there you heard our feedback from Tom, Colin and Darren. So as mentioned, we've already started the rehab classes. We started them 6 weeks ago, and the feedback so far has been great. It's really met the needs of our colleagues, and it's delivered what we hoped it would deliver for our colleagues in terms of helping them see how rehabilitation or the exercises can help them get fitter to be able to do the physically demanding job and to keep them confident doing their job. We've had people come in when they're off sick to do their classes, people on restricted duty, so we were working with them to get them back into their normal role. And then people who are on their normal or doing their full duties but struggling a little bit, and so coming to the classes to get them to where they need to be. As part of this journey, we also worked really closely with our union reps, so the GSS, NSP and panel reps, and they're very important in terms of delivering this at T5, getting this facility up and running. So we asked them for a quote, and this is what they've given. So I'll read it out. We have collaborated on the delivery of the BARS Health Hub, working closely with BARS, Heathrow managers and property. The gym space has been successfully completed. Providing on-site physiotherapy, rehab classes and health support is crucial for supporting recovery and promoting overall well-being. Our joint efforts aim to support a healthier workforce by prioritising musculoskeletal health through various initiatives designed to empower and assist our colleagues. Workplace well-being isn't just a perk, it's a necessity. When employees feel valued, supported and balanced, productivity rises, creativity flourishes and businesses thrive. A healthy workplace is one where people can do their best and feel their best doing it. And that's what's been really, really great about this project, is the fact that colleagues themselves have said that they feel really valued, that the business have provided them with a space, with a great gym, with great gym equipment and with rehab in their workplace for them to attend to keep them healthy and fit. And then when we were reflecting back on this project, I talked to Sam Reed, is a Senior Standards and Policy Manager, and it was part of the conversations I had with Sam over a year ago that led to a series of events that led to us opening up the Health Hub. So I asked Sam for her feedback as well. And this is what she gave, which I'll read out. She said, "It's been a blessing to be part of such an innovative project, which is leading in preventative measures in the MSK remit, and it's only just getting started. I'm so excited to see the benefits this will have for our colleagues and the business, and I can't wait to see how we progress, change, and adapt to new ideas as they come. The team I have worked with and the project is one I am very proud of." So that's a really great feedback. And we thought that the SAA rehab space will be one project and that's it. But what this project has done is it's now led to various other offshoots with other projects for us to deliver in terms of supporting MSK Health. So it really is just a start of looking at how we can embed more support within the workplace. Thank you for listening. Does anyone should we go to questions?
Yeah, so we've got a couple of questions. Somebody's asked if we are able to share the slide pack. I'm not sure if that's possible, Lina.
Yeah, well, we have to share part of it, definitely.
Okay, brilliant. We have a question from Victorina. Thank you, Victorina. How do you set the expectation results with client employee? Some cases obviously will have residual injury, which might restrict her fitness to work. But you did mention there about people coming in when they were either they were signed off sick or they were in there having restricted duties.
So set the expectations of our colleagues, is that in terms of coming to the classes?
Yeah, how do you set the expectation result with client, colleague?
Yeah, so the expectations we've always said with our clients, our colleagues, is that we want to improve their mobility, we want to improve their strength, we want to improve their power and their function. And we know what their job requires. Being embedded in the business, being in-house, they know that we understand what they have to do and the time constraints within they have to deliver their tasks. And then we talk through where they are and where we would like them to be. And that's part of the discussions that we have when we talk about the rehab classes, because we need individuals to be really engaged in going to the rehab classes. Usually, I've spoken to quite a few people, and the general theme is they generally are shocked at how unfit they are when they go to the first class, because they believe that they have got to a certain level of fitness. Then when they go to a class, we get them to do some of the exercises, and it really opens their eyes in terms of actually they're not quite where they thought they were, and why that means they have MSK issues. They might recover from that particular episode, but then they can have another episode later on. And so that's the preventative side of this. Essentially, the rehab is secondary prevention, but it involves conversations with our colleagues. We have also had great comms with managers. Managers have been really, really engaged, because managers also need to understand the role of these rehab classes and supporting their colleagues to attend. Say if they're on shift, giving them time to attend their colleagues. And managers have been very, very supportive. But then that also is based on the fact that we have a leadership team that are also very supportive. It's not just a tick box exercise for well-being. Their actions match their words.
Okay, thank you. We've got anonymous attendees saying, what else is BA doing to reduce the risk of MSKs occurring, such as redesigning the work?
Oh, there's loads going on. So I've only just joined full-time in this role in October, and this was the first start. And as that last slide showed with Sam saying this is the beginning, where it truly is a beginning. So we're working with wellbeing to create short exercise videos that our ground ops agents can have access to. And that's a project that we're working on with our wellbeing ambassador, Joe Wicks. So we've just done one with our ground ops agent. We're working with our safety team, looking at training. So what training goes in with our manual handling supplier, but looking at where the risks are, where the recurring problems are, so we can bespoke the training a little bit more to what is required. So there's loads of different things going on in the background.
And also, if I can input as well, within the baggage hall, they have lifting manual handling aids to reduce the risk of manual handling. And within our engineering teams, there's also new equipment that's been introduced, mechanical aids to help with the moving of engines. So it's not like a manual task now, it's actually done by a specialist piece of kit. And then Lina and I working on some DSC work, aren't we, to improve ergonomic posture and display screen equipment tools in the workplace as well.
Yeah, so I was just going to say, part of that is also having a different lens on it, right? Having a more of a health and well-being lens. So looking at what the evidence is shifting it from being a regulatory thing, which it obviously is, but to a more of a health and well-being aspect in terms of how to keep fit and healthy.
We have another question from Hakan, thank you. In the presentation, you mentioned that 53% of individuals with MSK conditions reported negatively impacting their work life. Data was also provided across different age groups. With that in mind, what improvement rates are achieved through rehab activities for MSK conditions across different age groups?
So with the rehab aspect, with our rehab classes, we are evaluating it pre and post. So we are asking about their workability. And so there's a workability questionnaire, which is really great to use. We've picked up 3 questions from there, looking at their workability over a lifetime, looking at their workability from the physical aspect, looking at workability from their mental aspect. We're also probably going to introduce the MSK-HQ, which is a validated measure which covers various health domains that are known to influence MSK conditions. And that will be part of the evaluation. That will cover things like sleep, emotions, isolations, impact on day-to-day activities. So if that highlights things in terms of where there are negative impacts or the score stays low, then that will allow us to then consider what further MSK initiatives we can put in place to help combat that negative aspect. In terms of the age group aspect, I guess we need to think of how we would capture that, and we'll be looking at the absence data. And that is one of the things that we'll be looking at, is people that can't get referred. What details do we need to show success of this initiative, but also success of the in-house physiotherapy. We already collect a lot of data in terms of the return to work, but there are other areas that we can collect, and that's something that we'll be looking at over the next few months.
So Asif has presented a question. In EPC projects, what role does behaviour play in HSE performance, particularly when addressing ergonomic risks that are often seen as normal, such as awkward postures or repetitive movements? How can behavioural involvement be strengthened to ensure everyone's fully committed to continuous improvement in this area?
So one question, what's EPC?
I'm not too sure, actually.
Whilst if you could just jot in the chat what EPC stands for, that'd be great. But in terms of the behavior aspect, that's so important, and that's such a great thing to ask, because it is really about health behavior change. I think when you go to the same environment and you do the same tasks, it can become quite habitual. So it's about making people aware. So we're hoping that with the Heathrow Ops, with the rehab classes, that it will make people a bit more aware of what's happening, because we've got mirrors across the wall as well. So a lot of the manual handling tasks we review with them and show them, this is actually what you're doing, this is how it should be. So to help encourage that health behavior change. But also, we don't want manual handling to be a tick box exercise. We want people to understand the reason for it. And that's not only manual handling, but DSE as well. So if we give people nuggets of information that explains why something is important, like the awkward postures or the repetitive bending, why you should do other activities to help combat that, then people can understand that. And I know within our manual handling training, the information that's given or how it's delivered, the language that's used in terms of delivering it does help with that. So I think it's down to language as well.
Thank you. Are there any other OH physio-led exercise groups for BO staff? So for our outstations, like, our teams in Manchester, Newcastle, British Airways, Engineering Wales, there is any plans to extend?
Well, this was a starting point with Heathrow Ops, and already having conversations with Cargo, because I have a gym there. So I have a call in a couple of weeks to discuss how we can work with them there and use that facility. And engineering are also looking at something, but it has to be really dependent on that area. So, like for example, cabin crew having an airside base facility for cabin crew may not work because they fly in and fly out. So we would need to look at how they can access the information. How can we make it easy for them to access the information that they need? But yeah, this is just a start. We'll be looking at how else we can support businesses.
Thank you. We've got another question from Hakan. Preventative measures such as creating a risk map based on job roles and work areas can reduce MSK disorders. What ergonomic improvements are you implementing in this regard?
So nothing at the moment, but there is one project we're working on. So we had some referrals from our GLA, so Global Learning Academy, to physiotherapy with injuries that they sustained whilst carrying out training for our staff. So looking at those injuries, I touched base with our safety team over there, and they are now looking at redoing their training, manual handling training for their colleagues. But what we're going to do is do a risk assessment pre that to identify what those areas are, so that we can make sure that that is covered off in the training that is delivered, and then loop back to what we were seeing in the physiotherapy clinics in referral. So that's just one example. The great thing about being in-house means that you can react to what the business brings to you. And that's always been our ethos.
Darren has posted a question. What treatment options do you typically offer? Just hands-on and exercise prescription classes?
Physiotherapy is a spectrum. I firmly believe physiotherapy involves hands-on treatment, but the key is to do a full objective assessment. So we allow an hour for an assessment, and we take into account the biopsychosocial model. So we understand the biological aspect of their injury or illness or their condition. And then we take into account the psychosocial aspects as well. And we spend time discussing those with the individual. And we find that the objective assessment is a key part of that, to be able to then have the conversations about the diagnosis and what the recovery is. And then treatment can involve hands-on treatment, it can involve acupuncture, it can involve graded exercise home program, and it can involve rehab classes. It can involve ergonomic advice as well, good working practices. So it depends on what that objective assessment identifies to what we deliver.
Thank you. EPC is engineering, procurement and construction. It's a common form of contracting work arrangements in large-scale infrastructure and industrial projects.
Okay. Thank you. I don't think I'm in a position to be able to answer that question, though.
What role does behaviour play in? I think we discussed that really, didn't we, about behaviour and addressing ergonomic risks. Okie dokie. Right, we have a question from Darren. Unsure if you're going to be able to answer this one, but we'll try. Have you been able to quantify, for example, using diametry for data collection to average desired force outputs staff members can produce to reduce injury and time off work? Easy using dynamometry. Dynamometry. Can't even say it.
Dynamometer? No, but what we have, I don't think this is going to answer your question, but we have just ordered, we haven't just ordered, we ordered a few months ago, dynamometers, so that we can measure the force in, say, for example, someone's quadriceps or hamstrings or biceps or push and pull. So we know where they are on baseline and where we need them to be, and then we'll measure them with that as they go through the rehab classes. So we have got that. And our colleagues find that extremely useful because we will email them the graph that comes with it and the score, because it shows them and it gives them an objective idea of where they are and how they're progressing.
Okay, thank you. From Ali, do you have the MSK study comparing the findings with other airports across the globe as part of benchmarking, determining how the MSK rate is across the globe as compared to the UK?
No, in short, no. But I think there's been a lot more interest in the work we're doing at BA, looking at MSK support. So I think those conversations are going to start going forward.
Okay. And thank you for attending today. We hope it's been useful and showing you the strategy that's been put in place to help with MSKs for our below-wing colleagues at British Airways. And we wish you a good afternoon. Thank you.
Thank you, everyone.